Family caregivers save our state, save our communities millions and millions of dollars every year because they're taking care of their loved ones at home. And oftentimes there's a cost, not only to older adults, but also to the caregivers themselves. They've talked about how they've had to reduce their hours at work or oftentimes leave work to care for their loved one. We've heard them talk about their own health issues and how they don't go to the doctor because they don't have time. We've heard from them say they'll do anything for their loved one and for their family members, but they've lost all their friends in the process. There's a cost to caregiving, and we have to support family caregivers so they can do their role every day.
When caregivers are feeling overwhelmed, some of the ways they can alleviate their burden is to take a break. Have someone come in and help with laundry or linens or personal care. Have a family member come in and help. They can go to a support group and sit with other caregivers who are in the same situation, who understand what they're going through. Care coordination is really a critical part of being a successful caregiver. If there is a family member who's the primary caregiver and they have their own family responsibilities to tend to, it is very challenging to juggle two households. They have their own family responsibilities, their own children, their own doctor's appointments, and now they have their aging loved ones' appointments and medical responsibilities to take care of. So it can be very challenging to balance all that. Keeping a schedule, keeping a notebook, and writing things down is a very helpful way to help keep things organized. It's very important for the caregiver to take care of themselves when taking care of an aging loved one. It's important for the caregiver to get plenty of rest, to exercise, and to keep their own medical appointments. When you take care of yourself, you're better able to take care of your aging loved one. Some families work very well together when it comes to caregiving. Other families may not. And very often, family dynamics can be a tremendous help or a tremendous cause of stress. Part of the way for caregivers to help manage that is when a family member comes in and is critical, you could have some suggestions for them as to how they can help. And those family members that are willing to help, put them to work. Have tasks ready for them when they offer, how can I help? Here you go. How about preparing meals once a week? How about taking care of other tasks that need to be taken care of? Family dynamics play a very important role in caregiving. It can be a tremendous cause of stress, and especially when spending money is involved or spending down some of the family finances, it can be a tremendous stress. So that's why it's important for caregivers to reach out to either other caregivers or other people that have experienced some of these challenges to get some guidance and some support, because it can be a very challenging role and very isolating. While caregiving can be very challenging and overwhelming, there's also many rewards. Maintaining a quality of life, providing dignity, is a precious gift that caregivers can give their aging loved one.